Hello everyone, I'm Dr. Anusha, Handral, consultant endocrinologist and diabetologist with special interest in osteoporosis. As we all know that 20th October is celebrated as a World Osteoporosis Day. I would like to take this as an opportunity to discuss about osteoporosis, to basically spread awareness about osteoporosis in general public. So most of you must be knowing what is osteoporosis. So osteoporosis is a weak bone which with minor trauma can result in fractures. So osteo, the word osteoporosis, the osteo means bone, porosis is a porotic bone or a weak bone. You can just see the screen. So this is how a healthy bone looks like. This is a magnified picture of the bone where we find this looks like exactly like a honeycomb structure. But in osteoporosis, what happens? The holes and the gaps in the honeycomb or in the bone, they enlarge. So there are a lot of holes and gaps and entire bone architecture is disorganized. So this will lead on to an osteoporotic bone or a weak bone. The incidence of osteoporosis is growing. We have around 200 million people living with osteoporosis worldwide. And it is estimated that 1 in 2 women and 1 in 5 men above 50 years of age have risk of having osteoporosis. So why is it so important and why is it so serious that we have started celebrating World Osteoporosis Day? That's because it leads to a lot of morbidity in elderly population especially. So osteoporosis can cause weak bones and fractures any of the bones in the body. But most commonly we have encountered osteoporosis related fractures in the wrist, in the spine and in the hip. So wrist fractures, usually we get to know that there is a wrist fracture, we meet a doctor and take treatment. Hip fractures are associated with severe disability, like the patient can become bedridden. It needs surgical correction and a lot of rehabilitation post-surgery. Why I say osteoporosis is silent is weak bones or the porotic bones or osteoporotic bones do not hurt until they break. That's important. You don't get to know that you have osteoporosis until you break the bones. One more fracture which is caused by osteoporosis is the spine fracture. Even these spine fractures can go silent. So now we will see how this is a spine. Basically we have the cervical vertebra. We need to know that spine is made up of multiple bones. These are the small bones which are stacked one above the other to form a skeletal structure. We have the cervical vertebra which usually do not break in osteoporosis. The thoracic, this part of the vertebra to which our ribs are attached, and the lumbar vertebra, the lower part. These can be involved in osteoporosis. We can have fractures. Important to note is when we have various forms of spinal fractures, sometimes we can have a wedge fracture. It's because of the weak bones, the vertebra can kind of get compressed. So the anterior part, the front part of the vertebra can get compressed and form a wedge kind of shape, and the back part of the vertebra remains its height. So basically what happens, the front part is getting compressed in the osteoporosis, the back part remains the same. So this will kind of lead to a spinal deformity. So you may have a hunch or a spinal deformity in osteoporosis related fractures. Sometimes you can have a fracture where the upper part of the vertebra or the bone or the lower part of the vertebra can get compressed. So this will essentially lead to loss of height. So many patients come to us with loss of height with spinal deformity. And another important thing is when you have the spine which is getting deformed, when you have multiple fractures, what happens to the nerve roots? These are the nerves which come out of the spinal cord. So these nerve roots can get compressed. Whenever any nerve root gets compressed, you can have constant backache, you can have some amount of numbness, sometimes some tingling sensation or a shock-like sensation from the back, and it kind of radiates towards the thigh and the legs. So these are the 3 important things which are associated with spinal fracture. There may be constant pain, there may be deformity, you may have a spinal deformity, or you may have a kind of, you can lose your height because of spinal fracture, or you can have some numbness, tingling radiating down from the spine, goes on to the thighs. Now most of the times we do not notice that we have sustained a spinal fracture. Usually when people fall at a particular angle which hits onto the spine, or sometimes they just lift heavy weight and they sustain pain, and then they feel that it's because of some muscle cramp. They take some painkillers, They sometimes do not meet the doctor. They just take their painkillers and take some rest, and most of the times this pain settles and the fracture doesn't get noticed until later when they develop a deformity and until they develop loss in the height or the nerve compression features or the nerve problems what I've described before. So it's important, until we screen for osteoporosis, we do not get to know unless we have a fracture. So who is at risk of having osteoporosis fracture? It's very important. Like general public, who is at risk of having osteoporosis fracture? As most of you know, post-menopausal women, like people who have, the ladies who have attained menopause. So above 65 years is a very crucial age, and men, older men also can sustain fractures. We have seen osteoporosis incidence is very high in females because of some particular reasons. Women have a thin vertebra or a thin bone, and because of estrogen, like when we have menopause, when a woman attains menopause, there is a estrogen hormones which levels goes down. This estrogen actually maintains the bone strength during the entire period. Once the estrogen levels comes down, the bone becomes weak. So once the bone becomes weak, there is osteoporosis and there is risk of having fracture. So first set of people are postmenopausal women or elderly men, maybe 60 to 75 years of age. So they are at risk of having fracture. Next important set of people are who are having other associated health problems. Rheumatoid arthritis, people long-term diabetes, especially children with type 1 diabetes. Some people who are having intestinal problems, like you must be aware of a gluten allergy, the celiac disease. So those people are at risk of having osteoporosis. Next important set of people which we are encountering frequently now is steroid induced. The steroids can cause bone weakening. So it's very important. Steroids can cause bone weakening. People are taking steroids for various reasons, maybe for the allergy or the asthma or chronic lung condition, respiratory conditions, so or for some joint pain problems. So this steroids can cause the bone weakening. So this will lead ultimately to osteoporosis and fracture. And people who are quite underweight, like they are malnourished, they are also at risk of having osteoporosis. Family history of fracture, if you had your parent having fracture, so we have some genes which are marked, so these genes can be transmitted, so children can also have fractures. So all these are the risk people who are prone to have osteoporosis. Or perimenopausal women, so just before the menopause, that is the age when there is abrupt decrease in the bone density. We have this clinical disease called as premature menopause, where few women, they stop having menstrual cycle or the periods before 40 years of age. So these people are known to have premature menopause. So in that condition, they are prone to have this osteoporosis. So that's an important set of people who need to be screened for osteoporosis. Now, so we have learnt about what is osteoporosis, what it causes, and also we have seen the risk population. Now coming on to how do we diagnose osteoporosis. Very important. For a disease which is very silent, screening and diagnosis becomes at most important. Now we have a simple test. What we do in our hospital and diagnostic centers is the bone density estimation by a machine called as a DEXA. So DEXA is a machine which helps in detecting osteoporosis. So basically it's something like a sophisticated X-ray machine. Important to know that it is non-invasive. So for getting testing for osteoporosis or a BMD testing, you don't have to take any injections. It is completely painless, non-invasive, and it's quite simple. It doesn't take a lot of time, just few minutes. You can walk into any diagnostic center or into the hospitals where the BMD DEXA is available. So DEXA machine is available. You can undergo the test. You don't need any special preparation. One important point is just avoid calcium tablets before you undergo this test, at least for 48 hours. So this is only one of the prerequisite which is needs to be followed before you undergo a DEXA scan. So basically how a DEXA scan looks, it's a scanning table, so we have to lie down there, and there is an arm. It's like an arm which runs across the body. It will not penetrate you, it will not hurt you, it will just go this way and it will scan multiple sites. Spine, hip and the forearm are the sites which are usually scanned with this machine. It hardly takes few minutes. With the cloth, you can wear your clothes and get the scan done. One important thing about this test is you can get the reports immediately. So you get to know the reports as soon as you finish the test. Now this is widely available in various places, so you can contact and your physician and get a request for the same and get a DEXA testing done. Now I understand the COVID pandemic has changed a lot of things. People are slightly scared to go visit hospitals or diagnostic center to get a test which is just like a preventive kind of test. So for them we have a special kind of thing. It's called the FRAGS questionnaire. So this questionnaire, so because it's a list of questions which is available, it's like an easy screening tool what we use in community levels. So this screening tool is available in online in various websites. So it has multiple questions, a set of questions in the form of yes or no. You need to enter all those questions. At the end, the tool or the software will give you risk of having osteoporosis. It gives you a 10-year probability risk of having osteoporosis. If your risk is high or intermediate in that, then you can directly go and get a BMD DEXA scan. So this tool can be done at your home. So this is something which you can use the internet facility. It's just a software. You can log in and you can get the tool. It's called the FRAX. FRAX scoring tool for osteoporosis. FRAX FRAX tool. So that's another thing, easy way how we can at least find out we're at risk of having osteoporosis. Now next important, so we have seen how to diagnose osteoporosis. Next we'll go on to how do we screen for osteoporosis. It's important. That I think we have discussed about the DEXA. Which population, like who needs to undergo the screening? Definitely all postmenopausal women above 65 years of age, all men above 75 years of age should undergo this DEXA scanning. Again, younger age group who are having certain risk factors which I've discussed previously can also undergo DEXA scanning even though they've not reached the age criteria what I've mentioned. So perimenopausal women or men between 50 to 70 years can also undergo the DEXA testing. Who have at least one risk factor for having osteoporosis or bone related problem. Next set of people who are on long-term steroids, very important. Steroids affect the bone very badly. So people who are on long-term steroids for various health conditions, you need to consult your doctor and try to get a DEXA scan. People who are suffering from rheumatoid arthritis or any rheumatological conditions, ankylosing spondylitis. So these people also need to get their DEXA. Diabetic patients, so they are also prone to have osteoporosis, both the children, the type 1 and the type 2. Both of them are prone to have osteoporosis. So please, you also need to get screening done. And the set of people who have had premature menopause or for various reasons, if you are estrogen secreting the area, the ovaries are removed for various reasons. So if you have attained a menstrual cycle earlier, attained menarche earlier than 40 years, even you need to be screened for osteoporosis. Now, we have seen about the screening, whom should be screened. Now, next important thing is how do we prevent osteoporosis? Very important, osteoporosis can by far large be prevented to a great extent. First step in that is a healthy lifestyle and a good physical activity. So this holds true just not for osteoporosis, for diabetes, for hypertension, for cholesterol problems or cardiac problems or a heart attack. To prevent all these problems, a healthy lifestyle and a good physical activity is very important. You can do all the weight bearing exercises, walking, you can play some outdoor activities. For elderly population, a brisk walking would suffice. You can do some yoga and meditation. So all that is quite important. Next important is nutrition. So adequate calcium and vitamin D supplementation. So we consider bone as a kind of wall. So calcium and vitamin D are the bricks and the cement. So you need to help the formation of, for the wall you need good amount of calcium, vitamin D. For the wall you need bricks as well as a cement. So we need calcium and vitamin D to deposit in the bone and form a bone architecture or a bone matrix. Now calcium by far and large we can get through major extent through our diet. So as we all know, dairy products are rich in calcium. So our dairy products like milk, the yogurt, the cheese, the cottage cheese, the paneer and all are rich in calcium. We get through some green leafy vegetables, some vegetables, but non-dairy sources is not a very good source of calcium. So it is generally recommended that we take around 1000 milligram of calcium to prevent osteoporosis. So you can use a rough calculation saying that anywhere between 100 to 200 milligram we get through our green leafy vegetables or the non-dairy sources or the vegetables kind of. But dairy sources will contribute to the major extent. So if you think your diet is deficient in the calcium, please consult your healthcare physician, get a prescription for calcium tablets. So there are various formulations, one of them will be prescribed for you, and take your calcium tablets regularly. This is especially important for people who are having risk of osteoporosis and also for women who are attaining menopause. So perimenopause, just before menopause, so you start taking calcium supplements. Now next important mineral or vitamin is vitamin D. Now vitamin D, as we all know, it's basically from the seafood. You can get it through your fish, the seafood, the tuna, mussels and salmon are quite rich in vitamin D. Again, the vegetarian sources are quite limited with vitamin D. So I would recommend better is to get a supplement of vitamin D capsules or sachets are available. In the pandemic and as such, Indians, it is studied that in various studies that vitamin D deficiency is there rampant. So COVID has all the more worsened the situation. Most of us do have vitamin D deficiency. So it's always wise to get your vitamin D levels checked, and then you can take a proper corrective dose of vitamin D after consulting your healthcare professional. Third preventive step. First is healthy lifestyle and exercise, physical activity. Second is adequate intake of calcium, vitamin D. Third is avoid alcohol. Stop smoking. So alcohol needs to be moderated. So that's important to prevent osteoporosis. So excessive smoking as well as alcohol is associated with osteoporosis. So we stop smoking. That's important, and then alcohol needs to be moderated. Fourth important is screening. Again, undergo screening, undergo BMD testing with a DEXA machine at regular basis. Fifth, and by far and large, the most important one is fall prevention. As we know that we have weak bones, so with slightest trauma, minor fall, you may sustain a fracture. So we try to prevent falls. That's very important, and this point is extremely important for fall prevention. Please do listen. More applicable for elderly population. So how do I prevent a fall in an elderly population or elderly men and women? First is get eyesight checked. Your vision, if you have a cataract, if you have a refractive error or a spectacles, you need to get your vision checked, and you should have a clear vision for movement or for walking. Next, get your hearing checked. So hearing is important. So hearing needs to be checked, and if required, corrective aids, hearing aids can be used. Third important, most of our elderly population are having urinary problems. They have urinary incontinence, so they cannot control the urine. So in that hurry, while walking to the washroom, we have seen many people falling and sustaining a fracture. So if you have urinary problems, consult your healthcare physician or a neurologist and get your urinary incontinence problem settled. Fourth, whenever you're walking, use a good footwear. So not a very loose footwear so that it can just slip and you can just fall. Use a good footwear. Number fifth in prevention of fall is don't walk on slippery surfaces and avoid walking outdoors during rainy seasons. Wherever there's waterlogging, please avoid walking on those areas. And whenever you're climbing stairs, make sure you have railings on either side. Make use of railings while you climb up or climb down. Next important is you have to change your washroom settings, the bathroom settings. You have to fix some handles, some assistive devices. That's important because most common falls in elderly population usually happens in the washroom because of the slippery surface. And another important point is you have a good lighting at the home. This is very simple. Have a good lighting at the home. You should have good tube lights and good lighting at the home. Avoid walking in the dark. We have many of the elderly population who are taking BP medications. They have some nerve problems, they're taking medications for that. Some psychiatric problems, they're taking medications for that. So some of these medications are known to cause dizziness or giddiness. And as such, elderly population without these problems can have some amount of giddiness and dizziness. go and meet your doctor and try to sort it out. Change your medications for BP, whichever is causing this dizziness. Important is the actions in the elderly population should be slightly slow. So whenever you're getting up from the bed, try to get up from the bed, sit and put your, dangle your legs down for 2 minutes and then slowly get up. What exactly happens when you do this briskly, get up and then you suddenly get up from the bed, you will have a sudden drop in blood pressure. Normally, every one of us have drop in blood pressure, but it is not very significant. So when it becomes very high, the BP drop, when it becomes significantly high, then you will have dizziness, you may just fall down. So make sure all your steps are slow, getting up from the bed, sit for 2 minutes, dangle your legs down and slowly get up from that posture. So this is all about fall prevention. So preventive, what have we seen? Healthy lifestyle and exercise, avoid smoking, alcohol intake should be moderated. Third is good calcium and vitamin D at the recommended doses, calcium and vitamin D intake. Fourth is screening for osteoporosis. Fifth is important, fall prevention. Now, so we've seen about prevention. Coming on to a few lines about how do we generally treat osteoporosis. When you visit an healthcare professional, he will order a DEXA testing, and if you have already done that, he will see the reports. We have some T-scores which are displayed in the report. Based upon that, we decide the therapy. So first and foremost, you will have a prescription for calcium and vitamin D. Next important is based upon your fracture risk and your bone density, and if you have sustained a fracture, there are various therapies which are available. So you can consult the healthcare professional for the same. We have oral tablets, we have injections. So we have everyday injections, we have some yearly injections, we have daily tablets and 3 monthly tablets. Based upon your profile, you will be advised some medications or injections. So be compliant, very important, be compliant with your bone protection therapy, because the effects of bone protection therapy, whatever we prescribe as an endocrinologist or an orthopedician or a doctor, the effects are not immediate. Because whenever we do an EMD, we get some scores of -3, -4. Not that within 6 months it's going to become -1. It's not like that. It takes time. So bone accumulation takes time. At least 10% will be only the effect which is seen over a period of time, over 1 year. But definitely with bone protection therapy, the risk of fractures will be significantly low. So important, if you have osteoporosis, take good amount of calcium and vitamin D. Adhere to the bone protection therapy which is given by your endocrinologist or the doctor. So that is it about osteoporosis. Before I conclude, screening for osteoporosis needs to be emphasized among all healthcare professionals and in general public. Thank you so much for patient hearing. Thank you.